welcome. I'm Dr. Infantino from Platinum Wellness. People ask me all the time, like, why do people go to you? Like, what do you guys do there exactly? And in this really quick video, I want to give you an idea of what we do, who we see. We see a lot of people, actually. People come in with things like thyroid conditions that they can't get balanced, or hormones, or pre-diabetics or diabetics. We see people with autoimmune diseases. We see people who just want to lose weight, get their energy back. And it doesn't really matter which one of those someone has. My experience after, 25 years or so of doing this is it really boils down to one thing. And when I say this one thing, you're gonna go, well, duh, and that is just getting healthy. Now, I know that sounds kind of obvious, but at the same time, if we think about what we do in our country, it tends to be almost a little different, right? We usually end up with some kind of symptom, heartburn, constipation, whatever it is. We go to the doctor gives us some kind of medicine or something to take, and then we think, all right, well, we've got this cure, it's all better. Now, please understand, I'm not opposed to medicine by any stretch, but I think most doctors would agree if we could figure out what's causing the problem and eliminate it, we'd be better off. Weight gain is one of the things that I see so often that, there are some people who they eat a little better, exercise a little more, the weight falls off, and they live happily ever after. But there are other people who, I see that are eating 1,000 calories a day, they're actually eating pretty well, and they're realizing that all of a sudden, like, maybe my metabolism's slowing down. I don't know what's going on. I'm not losing the weight the way I used to. And that's one of the things I want to talk about today. The reason being is, what disease processes is weight gain associated with? Yeah, exactly. Almost all of them these days, right? Diabetes, heart disease, cancer, you name it, weight gain has something to do with it. So a lot of people think this. They think, if I lose weight, I will get healthy. Makes sense, right? I think that's a little bit backwards thinking, and I'll explain. I think if you get healthy, you'll almost automatically lose weight as a side effect. See, most of the weight loss programs we use in this country are what? They're almost always at the expense of our health. We've got fen-phen and HCG and diet pills. We got high protein diets. We've got all sorts of things. You can count points the rest of your life, but here's the reality. How many of those things can you do long term? Yeah, really? Like about 0 of them. Why? Because they're all treating a symptom of a problem without addressing the problem itself. So with that being said, what could be the problem? Well, many times it's simply a body out of balance. Now, what do I mean by that? Well, before you say to yourself, well, it's just my metabolism, it's slowing down, I would say, for some people, I think as we get older, certainly our metabolism is different when we're 60 than it is when we're 16. But it doesn't really account for what I'm about to explain next. In fact, you ever watch the news and you look at people in countries around the world, are they all overweight? Well, in America today, can you imagine 75% of our population is overweight? And I'll go into some of the causes for that, but the reality is this. It is not all because we just woke up one day and started eating more. If you go back into the teens, 20s, 30s, 40s, 50s, the weight of Americans was relatively constant. Hit late 70s, early 80s, it skyrocketed. And I'll explain a little bit more about that. But ultimately, it's not so much our metabolism as much as what's going on with hormones in our body. Right? You got 2 main sets of hormones when it comes to weight loss. There are fat storage hormones and fat burning hormones. So hear me out for a second, because here's what we all do. We go, okay, I'm going to go on a diet. So what I'm going to do when I go on this diet is I'm going to try to burn fat. Makes sense, right? So I'm going to do some of the things I mentioned before. I'm going to eat only protein. I'm going to exercise like crazy. I'm going to take over-the-counter diet pills or HCG, whatever. And they're all doing the same thing. Let's get fat burning higher. Here's the challenge for many people, and you might fall into this category. It might be that your fat storage hormones are already dominant. Now, how does that happen? Well, it can happen through environmental toxins. According to the EPA, for instance, the average American, if you can imagine, has 400 to 800 toxins sitting in their system. I'll address that in a second. It could be things like gut imbalance, right? 1 round of antibiotics is enough to screw the gut up. When the gut's screwed up, I'll draw it out for you. It'll certainly put you in fat storage mode. So you combine that with several other factors, and all of a sudden fat storage hormones start creeping up. Now, the same diet, if you're balanced, a little bit exercise, a little bit eating well, weight falls off, everybody's happy. If fat storage hormones are up here though, and you do a little bit, what happens? Nothing really, right? And then you do a little bit more, and you push it really hard. You're like, all right, I'm gonna go to the gym 5 days a week for an hour and a half. I'm gonna eat, like chicken and celery sticks, and I'm gonna pray. Okay, I'm doing it, it's working, I'm losing some weight. How long can you keep that up for? Exactly, like, the average person, maybe a few weeks to a couple months, and then boom. And if fat storage hormones are still dominant, what happens? The weight comes back. In fact, when someone goes on a diet, in this country, the average person who diets and loses weight, 10 or more pounds, I've read statistically, they said, is 2.2 pounds heavier than they were when they started 6 months later. In fact, the average woman in this country is on a diet 28 years of her life. You know that whole, all right, I'm gonna start on Monday all over again. And you hit Friday, I'm off, and now I'm back on again. So the idea, the strategy we use in the office is, look, we don't need to be dieting our whole lives. The person who's thin and healthy and not thinking about this, right, they're not perseverating on food or counting points every day. They're going out, they're living a healthy, active lifestyle and enjoying life. Some of us can't get there simply because fat storage hormones are dominant. So I want to spend the next few minutes just explaining that. Because if you can get this back to here, a simple, healthy lifestyle does all the rest. Make sense? All right, so with that much said, let's kind of fly through some of this stuff. I already mentioned how the majority of us are overweight these days, right? Again, it has to do with several things. One is toxins. We all, these days, I want to say we all, but most of us, if not now, at some point have done food in a box, a bag, a can, a wrapper. And I know what you're thinking, like, well, we all know that's bad for us. And we all know we shouldn't have white flour and white sugar and all these things. But here's the reality. Those things, over time, create a problem in the system. One of them being toxins that I mentioned before. Right? So what happens when we get too many toxins in our system? Well, they end up in a fat cell. So of the almost 80,000 toxins introduced in our environment in the last 30 or so years, 40 years, according to the EPA, amazingly, your body can eliminate about 50,000 of them, which means about 25, 30,000 of them has no way to get out. So if it can't eliminate a toxin, what does it do? Exactly, it has to store it somewhere. So they're mostly fat soluble. Where do they end up? In a fat cell. Now, why are toxins in a fat cell a problem? Well, for many reasons, right? One reason in particular is, well, we think about hormone imbalances. Toxins, what do? They compete, mimic, bind hormones. This is why almost everybody needs, bioidentical hormones and all these things today. And look, I'm not saying nobody needs it, but some of these things we have to just address. What's another thing? Well, toxins will keep us overweight. Why? If you go on a diet and you start pulling fat out of a fat cell, what gets left behind? Exactly, the toxins. Now, if toxins are left behind, what does your body try to do as soon as possible? It says, hey, I don't like this concentrated amount of toxins in this cell, so let's dilute it as soon as possible. They call that now the rebound effect, which means no matter how many calories you're eating at this point, the body says, put more fat back in there. You're eating 1,000 calories? I don't care, I gotta protect this cell. I gotta add fat back into it. Does that make sense? So that's just one of the problems we deal with these days. And when you think about things like MSG, artificial sweeteners, flavors, the average American eats 9 pounds of chemical food additives every year. And that's if you're trying to be pretty good, 9 pounds. So we add to that things like pesticides and herbicides and steroids and preservatives all in our food. And what's going on with our food supply today? I read a book recently by a medical doctor who goes, the average food supply today, he goes, 75% of the stuff we eat is dead or toxic. And he goes, the other 25% you'd think would be great, but some of the vegetables we grow in the same soil year after year. So what happens to the mineral content? It goes down and down and down. And so our study recently I read, they said to get the same amount of vitamin A and iron from spinach today as you did back in the 50s, you have to eat 7 times as much. Is anybody eating 7 times more vegetables than we used to? Not really. And when you combine that with things like thyroid health, which I'll get into briefly, I will say this, I can't tell you how many people have come in over the years and said, you know what, doc, I don't get it. I have like low energy, my hair's thinning, my skin's dry, the outer third of my eyebrows are kind of thinning. Everything, when I Google it, people are educated these days, they go, everything says what? Thyroid condition. And I go to my doctor and he tests it and he tells me what? It's fine. But here's one simple problem one thing that may cause this. It may simply be that you don't have what? Enough iodine in the system, right? Because remember those green leafy plants we were talking about that are mineral depleted? Main source of iodine. And so, not to get too into it for this short video, but ultimately, we have a lot of environmental toxins that are halogens, just like iodine, that will take the place. So if we have exposure to chlorine, right? Take a shower in the morning, breathe in chlorine gas, or things like fluoride or fluorine, your body will literally make thyroid hormone out of those instead of iodine. You have it, it shows up on a test, the thyroxine, the hormone the thyroid makes, but it's not as functional as it needs to be by far. Does that make sense? So our approach in the office is not, hey, let's just throw a medication at this if we can avoid it. Now, you can't always, but if you can, great. By getting the bad stuff out, adding some of the supplements in, and that's why we do some simple assessments. The assessments, which you'll be able to click at the end of all this, and if you want to fill out an assessment, it'll shed a lot of light on what's going on with you in particular. As far as the toxins thing go, what's our approach? Really pretty simple. Our approach is not to pull fat out of a fat cell, but to basically encourage the body to cleanse and pull toxins out of a fat cell. It just so happens they're transported in fat, and then there's no rebound effect. So, with all that said, I want to share something with you that I think really kind of sums this all up as far as how we get other imbalances in the system. And one of those is a gut imbalance. So we got things that come from a box, a bag, a can, a wrapper. Think anything, the big P, processed. And you can also think about rounds of antibiotics you might have done for dental work, whatever the case may have been. And so these things all go, now I'm not an artist, bear with me, into our systems. And eventually these things are going to hit our digestive system, our stomach, a couple organs as we go along. This food that gets digested eventually has to end up where? In our bloodstream. So if you stick with me for the next 5 or so minutes, it'll change everything. So here's what happens. This food goes in. All this processed stuff over time. By the way, coffee, I know no one wants to hear that, will affect us in a big way. Not 1 cup once in a while, just consistently drinking it. Any kind of, what else? Flour is huge for this. Grains will do this over time, the wrong ones. They decrease the acidity of the stomach. Why is your stomach acidic in the first place? Yeah, exactly, so you can digest your food. So if your stomach is not acidic enough, what happens? Well, you don't digest food very well. Now your stomach's going to do its thing. Now eventually, a couple hours later, it says, hey, contract, send the food downstream so that the next batch can come in. So far, so good. But if it's not digested well enough, what happens? Well, there's a valve right here, and this valve looks at that food and it goes, I don't think so. That is not digested. Why would the valve be there in the first place? Well, to protect a really delicate environment is one of the reasons. When I say delicate environment, what I mean by that, in your gut, your small intestines, you got these little hair-like fibers called villi, and they're covered with about 100 trillion bacteria. Now, these bacteria are there for a reason, and they are essential. What do? Well, one of the things they do is they digest food. Another thing these bacteria do is they make B vitamins. You guys remember what B vitamins give us? Exactly, energy. You know the number one reason people go to the doctor today? Fatigue, lack of energy, which I'll explain more about in a minute. What else? They decrease cholesterol, they decrease blood pressure, they alkalize the body. Can't even lose weight if your body's acidic. They do a whole bunch of things. So, how did those bacteria get there in the first place? Being breastfed, going through the birth canal. What percentage of Americans did both of those that are adults today? I've read as low as 2%, if you can imagine. So most people don't get these healthy bacteria to begin with. And then we grow up with dairy, eating Pop-Tarts, grains, all things that create more imbalance. So here's what happens. This valve says, I don't think so. You're not coming in. The stomach contracts, says, well, I got to get this food out of here. So what happens? This valve contracts also. But here's what's interesting. This valve is not as strong as this valve. So what happens? Food starts to leak back up many times. If food leaks back up, what do we call that? Exactly, acid reflux. You know, we spend billions of dollars on acid reflux medications. And here's the reality. It's not usually because people have too much acid. Many times they don't have enough acid, and the acid then ends up in the wrong place. So before we have acid reflux, though, if your stomach contracts and 2 valves are both closed, what do we call that? You ever eat something and go, ooh, that didn't agree with me? Indigestion, right? Now eventually, what's going to happen? This food is going to be let in here. It's not acidic enough. It doesn't create an environment that supports these healthy bacteria living. So what happens to them? Slowly they die off. If they die off, they're going to be replaced by who? Unhealthy bacteria, and who else? Yeast. So normally, you might have this much healthy bacteria and this much yeast. If we start chipping away at this, or we didn't have enough to begin with, what happens to the yeast and the bad bacteria? They start getting bigger and bigger. Now, question, what do yeast love to eat? All these things, the flours, the grains, the sugars, the coffee, the alcohol, they'll eat any of that stuff. So now we got yeast in the system. But remember, what do we say they do? Well, let's start with what they don't do. They don't digest food. So now we have undigested food heading downstream. What happens? Pancreas sees this and does what? Well, normally the pancreas is pumping out insulin, right? It's going to help digestive process. If the food's not really digested, the pancreas is like, looks like I'm up, overtime for me today. So the pancreas starts going, pumping out a bunch of what? Insulin. As the pancreas pumps out more and more insulin, insulin levels go up. But also, insulin is a fat storage hormone. Remember we were talking about fat storage and fat burning hormones before? Now we're getting fat storage hormones. How do you know if this is you? I'll give you an idea later of how to sort of test yourself, but if you feel gassy, bloaty, constipation, less than 2 well-formed bowel movements a day, acid reflux, fatigue, those are some of the signs that maybe I've got a gut imbalance going on. If you fill out the assessment later, you'll get a report. I'll explain to you exactly if that's going on in your body or not. But we just say this is probably fairly stressful to your body. Food's not being digested, it's outgassing, you're getting kind of bloaty, doesn't matter what you eat. Does that sound familiar? So since it's stressful, your body pumps out cortisol, which is what? Another fat storage hormone. So now we're in fat storage mode. Can you out-diet this process? It's tough. Why? Well, one thing is, these guys crave this food. So you ever sit there going, I just don't have enough willpower, I really want these things. You may not want them, but you're just going to have a hard time out willpowering your physiology. All right, now let me explain real quick what happens next. Food's still not really well digested. What happens to it? It starts heading downstream. Where does it have to get eventually? It's got to get into your bloodstream, right? All digested and pretty, your body uses it all. But in between here and there are what? Some cells. If the food's not digested, it can't get through the cells. So then what is your body forced to do? Well, it literally has to leak food in between. What do we call that? Some of you have probably heard the term leaky gut syndrome. Well, this is it. Now the body is forced, instead of starving to death, it says, hey, I've got to get some of this food in here, but it's too big. It's like chunks of food in the bloodstream. Does your body like that? It hates it. So what does your body do next? Next, the body says, hey, these are foreign invaders. Activate who? The immune system. And what does the immune system do? It attacks. Who's the immune system attacking in this case? You. So what do we call that? Autoimmune disease. The number of which are rising at a staggering rate. Back in the 50s, there were 8 or so main autoimmune diseases. Today, there's over 80 of them. All from what? Well, I can't say all, but the majority are caused by things like our food, stress, a lot of potential factors. But here, now your body is constantly working against itself. What's going on with stuff like this today? Allergies. We got more or less of those. Well, if your your immune system's always hyperactive, I mean, I grew up at a time when I never had a friend who could die from eating a peanut, right? We got allergies that are going like this, and we wonder what's causing all this stuff. Well, in many cases, it's what we're doing to ourselves. But here's the thing. A lot of people come into my office like, Doc, I don't do this anymore. That's not my thing. You know, I eat really clean. But you can't undo this just by eating well for a little while. I'll give you a good analogy. If you have a swimming pool in your backyard and it's green, right? You could get a garden hose and start adding clear water to it. That'd be like putting just good, healthy food in here now. It's okay, and it might overflow to the point where it's clear, but ultimately, if you want to clear it out, what do you have to do? Drain it, scrub it, and fill it again. It's kind of the same idea with your digestive system. This is why they're actually doing fecal transplants at Mayo Clinic right down the road now, to get this all out and establish the new healthy bacteria again. Now, there's a much easier, cheaper way to do this, but I will say this. At the end of the day, getting this cleaned out and functioning properly, they estimate about 80% of disease processes that people deal with today, all the ones I mentioned in the beginning, can be traced back to an imbalance in the gut that most people don't even know if they have. That's why we do some assessments to figure that all out. So ultimately, where does all this leave us? Well, how do you know? Let me start with this. How do you even know if you might have this? So here, I'm going to go through a couple potential conditions that may alert you to like, do I have something going on with this? So in the last 3 to 5 years, just think, as I mentioned some of these, have I had 1, 2, 3, 4? Not a big deal. 5, 6, 7, maybe you got an imbalance like allergies, congested nose, hives, headache, weakness, cramps, diarrhea, irritability, depression. Those are all things, again, that can be an imbalance in the gut or signs of increased sensitivity to food or chemicals. You smell someone's perfume and it bothers you. If you're gassy or bloaty, heartburn, constipation, spastic colon, like, man, I gotta find a bathroom now, frequent sore throat, canker sores, yeast infection would be an obvious one, anxiety, bladder control issues, PMS, irritability, moodiness, sleep problems, panic problems, fuzzy thinking, confusion, inability to concentrate. If you're fatigued, if you crave sugar, you're like, I just got a sweet tooth, high blood sugar or low blood sugar, it keeps fluctuating. Those are all potential signs of an imbalance in the gut, which could mean fat storage mode. And then ultimately, it can damage the intestinal system. Then you start getting things like leaky gut, which can cause a host of problems. Things like depression and anxiety, stuff I just mentioned. What do we tend to do? We tend to treat each one of those with some kind of medication. Again, I'm not opposed to medications, but if we could solve the problem, wouldn't we all be better off? Now, sometimes people come into me and they say, well, I'll just exercise this all away. Let me ask you a question, honestly. Is this person even healthy enough to exercise? What happens when they exercise? Well, they're already not getting food the way they need to. They're not digesting stuff. Their body's kind of stressed. So exercise is what? It's just another stressor. So what does it do? It increases cortisol. This is the person who goes and exercises. They make it through a few weeks to a couple months. And they're like, I'm just worn out. What's exercise supposed to do? Give you more energy. If it doesn't, it might be that you just weren't healthy enough to start it. That's why when we start, we usually stop people exercising and say, hey, look, let's just heal the body. Then, don't worry, we're going to turn you back on to that. But ultimately, all the calories you burned are offset by starting, creating more cortisol, and you end up like, man, nothing really changed. How many people have seen that? I have an office full of people. And then we address things like stress and poor liver function. At the end of the day, our office is pretty simple philosophy. Cleanse the body, restore balance, so that you can ultimately burn fat and live happily ever after. Most of us chase cycle after cycle of diet. We try this, we try that, and we go, I guess I'll just start all over again. Most people, though, please understand this, have low willpower. Why? Because the body out of balance experiences cravings. If you've got yeast sitting in your gut, you're going to crave the box bag, canned food, the flours, the grains, the sugars. Trying to give those up, they say sugar is 10 times more addictive than cocaine. If you were addicted to cocaine, would you wake up in the morning and say, hey, I think I'm just going to stop today? What are your likelihood of success? Well, if sugar is as at least or more addictive than cocaine, not good odds that you're going to wake up and just give up sugar. We all know what we should do, right? Everybody knows. You could Google it. How do you eat healthy? How do you exercise? The reason it may not work is simply an imbalance. If you'd like to know for sure if this is going on in your system, pretty simple. Click on the link or call us at Platinum Wellness. We'll send you an assessment. With the assessment, all you have to do is fill out some multiple choice questions. It's fed into a computer program that's tracked people for years and basically gives us a printout. What's going on with your adrenals? What's going on with the thyroid health? What's going on with gut health? Once we know where we're starting, we have a much better idea of how to map out a road that is customizable for everybody. So again, if you'd like a little bit of light shed on it, I'm happy to help. We're really passionate here, not so much about helping someone just fit into a pair of jeans, but about getting their life back. What's the main symptom of all this? Man, I just don't have really any energy. I don't feel like I get home, I'm too tired to go exercise, forget have a relationship with my kids or my spouse, or really enjoy life. That's what we love to see. I mean, we've got books and books of stories of people's lives who, started new relationships, started new businesses, all because they felt better. This isn't a dress rehearsal. At the end of the day, this is it. You get one shot around. And so if I can help you just sort of figure out the difference between dieting over and over again and actually truly restoring your health and getting your energy and life back, I'd love to be part of that for you. So click on the link or call the office 602-866-8100. Be happy to help. Thank you so much. I appreciate your time.